Hello everyone, I hope you all are doing fine. Welcome to all of you on my YouTube channel. My name is Dr.Shweta Sharma, and today in this video we will be discussing about a most common dental problem, that is gum recession. So what is gum recession? What are its symptoms so that it can be diagnosed at early stage, and what can be the reasons so that we can prevent it from happening, and its home remedies as well as dental treatment. So we will be discussing all these aspects related to this dental condition, that is gum recession. So this video is going to be very important, but before starting the video, if you are new to the channel, make sure to subscribe the channel below and press the bell icon so that you can get every notification. So now let's get started. So question number 1. What is gum recession? Gum recession is a dental condition when our gum tissues pull away from the tooth surface, exposing the root surface underneath. See, our gums play two most crucial functions in our oral cavity. First of all, our gums make a tight seal around our teeth to hold them on the place. And secondly, our gums make a barrier against the bacteria to enter in our gums, which generally causes infection. So basically they prevent the infection that is caused by bacteria. Now I will be sharing some symptoms of gum recession so that you can diagnose it in the very early stage and you can start taking precaution as early as possible. So when you start noticing that roots of your teeth are getting exposed, or the size of tooth is larger as compared to normal, you can have a look in the mentioned photograph here that your roots are getting exposed. The tooth which is having gum recession is larger as compared to adjacent teeth. Along with that, you can notice teeth sensitivity because our dentinal tubules are getting exposed after the gum recession, and we start to feel sensitivity against hot and cold things. Or you can feel that there is a pain or swelling or bleeding gums condition, or you can start noticing the symptoms of bad breath as well, which is generally caused by plaque and calculus that get deposited on our teeth, and that acts as a host for the bacteria. Now moving on the reasons. What can be the reasons for the gum recession? First of all, definitely poor oral hygiene. Either you are not brushing on time, or you are brushing on time but your brushing technique is not right. Because in most of the patients, when I ask about their brushing technique, they just tell me that we do like this in horizontal motion and very vigorously. Even I have noticed in my personal family members as well. That is a different thing that I made them realize, and I made them teach right toothbrushing technique. But in general, what people do is they do brush in horizontal motion, and that too very intense. You can notice it by yourself only that if we do toothbrushing in horizontal motion and that too very vigorous, then it is definitely going to harm our teeth, right? And that is the most important reason for gum recession. Don't worry, I will be sharing the right technique for toothbrushing in later part of this video, when I will be covering all home remedies to prevent this condition in early stage. Now moving on to the further reasons for this condition, gum recession, that is gingivitis and periodontitis. These are basically gum conditions whenever either we don't brush on time, or we skip brushing, or if our toothbrushing technique is not right, then plaque and calculus, these are some food particles which get deposited on our teeth surface. You can notice from this photograph that plaque and calculus get deposited on the tooth surface in between the gums. See, gums make a tight barrier on the tooth surface, like if it is the tooth surface, and gums just make a tight barrier with them. But when the plaque get deposited between the tooth and the gums, then it separates them, right? And this plaque and calculus make a host for the bacteria. So bacteria also enters here, it gets infected, and the gums which are just right here, they get infected, and that is called gingivitis. In gingivitis, you can notice there are swollen gums, bleeding, and excruciating pain can be felt in this condition. And this is very initial stage. If you don't get treated at this particular stage, then the infection, the plaque and calculus and bacteria can go further in between the gums and teeth, and they can create a huge gap between the gums and tooth. Gums get totally detached with the tooth, and the tooth can start moving. That condition is called as periodontitis. So if you want to keep your teeth maintained for a lifelong period, then I would definitely recommend you to maintain your oral health as much as possible. Next reason can be aggressive toothbrushing technique that I have just mentioned. See, what is the purpose of doing brush? Basically, whenever we eat or drink something, the food particles get attached to our tooth surface. By aggressive toothbrushing, we do not have to chip off our tooth surface. Only and only purpose of toothbrush is just to remove the particles which either get deposited or get collected on our tooth surface. Alright, so you can gently pull the particles down and rinse it off. That is it, and that's how the purpose of toothbrush works. And there can be a genetic reason as well. If your parents or your grandparents are having gum recession condition, then there can be high potential or high chances for you to get gum recession as well. So in such case, if you have noticed this kind of thing in your family, then you should really take the oral health into consideration. And the most important reason, hormonal changes, either at the time of pregnancy or at the time of menopause. When your hormonal level changes by time, then it is really important to keep your oral hygiene maintained, at least for the time being, because afterwards your gum starts to regrow. But at this time being, you really have to keep your oral hygiene maintained so that these will not get traumatized or won't get that much damage till the time of delivery. So now let us discuss about the most awaited part of this video, about the home remedies, so that we can prevent this problem at a very initial stage. So first of all, proper oral hygiene maintained. See, toothbrushes can be of many different types on the basis of their bristles. Either the bristles are ultra soft or hard. So mostly you have to choose either ultra soft or soft, and your technique of brushing should be correct. That is just a circular motion and pull the debris, food particles down. And same way in the lower arch as well, circular motion, pull up, circular motion, pull up. And that is how you have to cover all teeth surfaces on the outside and inside surface as well. Do brush at least twice a day, in the morning after having your breakfast, at night just before going to bed, because it is very important to know that after brushing your teeth, you are not supposed to do any kind of snacking before going to sleep. And your toothbrushing technique should be very gentle. You do not have to harm your gums, right? And after brushing, the flossing is a very crucial part, because it helps us to clean the interdental space, that is the space between two teeth where the food particles get deposited. So we have to clean those areas also. So for that we use flossing. Plus you can use salt water rinses. Dissolve half a teaspoon of salt into a lukewarm water and rinse your mouth for 30 seconds and spit it off. You can repeat this process at least 2 or 3 times per day, because salt has anti-inflammatory action and it promotes the healing as well. Same way you can use aloe vera gel. Use the natural aloe vera gel, apply it on the area where you are having the gum recession problem, and keep it there for a few minutes, and then you can just rinse it off with a normal water. Aloe vera has soothing effects and anti-inflammatory effects as well. Or you can use green tea also, because green tea has antioxidants which promotes the gum health. So you can brew a cup of green tea and let it cool. Rinse your mouth for at least 30 seconds and then spit it off. Or you can apply turmeric paste as well, the same way as you applied the aloe vera gel. Or you can follow oil pulling process as well, where you can take a tablespoon of any edible oil, that can be virgin coconut oil, sesame oil or olive oil as well, and take it in the oral cavity, squeeze it in your oral cavity for approx 10 to 15 minutes and then spit it off. This oil pulling method reduces the harmful bacteria in our oral cavity. And the most important diet which is important for our gums health, that is vitamin C. It is present in particularly citrus fruits and green leafy vegetables. You can add these things in your diet because vitamin C supports the gum health and collagen production as well. Well. One most important thing which I just forgot to mention before starting the home remedies, basically, because all of these home remedies should be followed at the early stage, initial stage of the condition, that is gum recession. If this condition has aggravated and if it has reached to an advanced stage, then you really need to follow dentist advice, dental professional advice, and any kind of dental treatment they will be suggesting as per your condition. Alright, so try to follow all of these home remedies which I have just mentioned for either to prevent the condition or to cure this condition at initial stage only. Alright, and one important thing, these home remedies take time to show their results. Now let us talk about the dental treatment options for this condition. First of all, see, like here in this picture I have mentioned, if you have any kind of plaque or calculus deposited on your tooth surface, then you can clearly go for dental cleaning. Alright, because this is a professional dental cleaning, it would not harm your gums or tooth surface. So whenever the plaque and calculus will be removed, your gums will again start to attach with your tooth surface and your gums will be healthier. Alright, so this is a very important and very basic dental treatment. After that, patients are generally advised for a mouthwash also for a proper kind of healing. But if your condition has aggravated to a little advanced form, then surgical kind of treatments are also advised. Firstly, gum graft technique. Doctor will take a tissue from your upper palate and graft it at the location where you are having the problem of gum recession. Second can be pinhole surgery, where a hole is created and collagen fibers are injected or inserted in the gums to make them regrow. And you have to remember, for your treatment to get successful, you have to keep your oral hygiene maintained, because in between the time of healing period, if any kind of infection get created, then whole treatment process will go in vain. If you won't maintain your oral hygiene after the treatment, then there is no any certain guarantee for healing. So keep your oral hygiene maintained and visit your dentist on regular basis to ensure your healing process going right. So yes, this is all about today's video. I hope you all will find this video helpful. Along with that, if you are new to the channel, make sure to subscribe the channel below and press the bell icon so that you can get every notification. If you found this video helpful, do press the like button so that we can get appreciated and get motivated to do more work as well. We'll see you in the next video. Thank you. Good luck.
सपना साकार करने के लिए सबसे जरूरी है सही कोच का होना। चुनिए डेंटल एम्पायर एकेडमी को और करें अपने डेंटल एग्जाम्स का सपना साकार। डाउनलोड द ऐप नाउ।